Why are we so excited about the Femilift procedure? Well, many women have a loss of vaginal tone or even stress incontinence following pregnancies or just with aging. And prior to this treatment, the surgical correction of these two problems was quite intensive surgery. Therefore, these operations carried a high risk of complications, prolonged recovery, and not necessarily producing a satisfactory result. So the Femilift procedure is carried out in an outpatient setting with no anesthesia required. The actual treatment itself takes about 10 minutes to do for the average patient. And you can go back to work, you can carry on gym, exercise. There's no restriction in activity. The only restriction is no vaginal intercourse for 1 week after the treatment. And that's really just more a precaution than its actual necessity. The Femilift is a completely painless procedure. All of the patients that have been treated so far in South America and in the UK have rated the treatment as completely painless. The duration of the result will vary from individual to individual, but we expect it to be a long-lasting improvement because of the stimulation of collagen within the vaginal wall. The vaginal wall responds very vigorously to collagen formation. So we would expect it to be long-lasting. Depending on lifestyle, on things like smoking, diet, and also age, some women may require a second treatment after a year or 2 years, depending on that individual. Many women will suffer with stress incontinence, whether it's from a sneeze or a cough or running upstairs, or the classic things that everyone says is jumping on a trampoline. Well, most of our patients don't jump on trampolines, but they still have problems with stress incontinence. And this is mostly due to the loss of vaginal tone on the anterior wall of the vagina, which fails to support the urethra. What does that do? Well, that not only allows urine to leak out of the bladder, but it also allows bacteria to get into the bladder. So many of these women will also have recurrent infections, bladder infections, cystitis, for which they may be taking antibiotics on a regular basis. And I personally don't like patients to be on antibiotics on a long-term basis for these type of conditions. I think that we should treat the problem. By using the Femilift, we're able to tighten up the tissue over the urethra and therefore completely stop stress incontinence and eradicate the risk of recurrent cystitis.